Hi there, my name's Dr. Laura Sadler, and I'm the chair of the Resident Project Committee here at Dalhousie University. I'm here today to go over a presentation on evaluating resident projects. First of all, we want to say thank you to all faculty for taking part in resident project evaluations. We really do appreciate all the time and effort that it takes, and residents do appreciate this as well. It is important to note that residents do need to have their projects evaluated at either acceptable or better to graduate. So I thought I would just go over the difference between a project coordinator and project supervisors. Project coordinators are available at every site, and they counsel residents on the format and relevance of their project to family medicine, as well as the specific project requirements. Project supervisors, on the other hand, are a supervisor for each project, and they oversee the project and act as a content expert on that resident's project. It is their responsibility to ensure the requirements are met in terms of the forms that need to be submitted and if there's REB approval, etc. So this is all found in the Resident Project Guide, which is available on Brightspace, but I'll just briefly go over the goals and the objectives of resident projects. So overall, we're looking to see that these contribute to the understanding and effectiveness of family practice. Purpose being to develop skills that a resident can use in order to be a resource to a family practice and to provide an evaluation of these skills for their resident transcript. Specific goals would be to develop skills in asking and answering questions that are important and relevant to the discipline of family medicine, to stimulate creative and original thought based on questions encountered in practice, to practice the fundamentals of evidence-based care or other critical inquiry, to be able to communicate those results clearly to colleagues, and to promote an interest in family medicine research. There are certain resident project types. We have a research project, a practice quality improvement, or an audit. Coming soon, we will have quality improvement patient safety projects. There's a position paper or essay. There's also an educational tool option, or a literature appraisal evidence-based medicine review project option. Projects are a minimum of 40 hours of work, 2,500 to 4,000 words. Now, residents will say and explain that they do actually often spend much more time on their projects. There is specific project requirements that can be found in the Resident Project Guide. So residents, along with their supervisors and coordinators, need to ensure that the project meets all of the requirements before it's sent out for assessment. So before it's sent to you as faculty to review. So here's a breakdown of the actual resident project types with descriptions. So again, this is on Brightspace in the Resident Project Guide. So for a research project, that's a traditional posing of a question, reviewing the literature, selecting the methods needed, collecting original data, conducting the analysis, and reporting on the findings. Practice quality improvement project or audit identifies a practice-based question, constructs an audit tool, audits the charts, and reports on the results. Position paper, this involves an extensive treatise on a topic of importance to family medicine. Educational tool, this involves developing a tool or a resource that's useful mainly for education of physicians, other healthcare workers, patients, or the public. The tool does need to be accompanied by a description of how it was selected and a literature review and the reason for the need for the tool. Then there's a literature appraisal or EBM review. So this is a detailed review of the literature on a specific topic pertinent to family medicine. It's important to note that original research papers should be reviewed and appraised. So this table is in the Resident Project Guide, and it can help show residents how to set up their project based on the different sections. So you can see in the chart we have all the different resident project types across the top, and on the left we have all the different sections that are required. So every project needs a cover page, an abstract, introduction, a background, study design or methods, results, discussion, strength and limitations, and conclusion. They also should have references. So there is a summary there that they can read for more information. It's also important to note that we also have a tips and tricks document for doing a research project, also one for doing an educational tool, and one for doing a literature review. So that's useful for the residents as well. So for faculty reviewers, any and all faculty may be asked to review resident projects. It's only the Halifax site that actually assigns projects to faculty other than the site director or the project research coordinators, and that's mainly due to the volume of projects in Halifax to be marked. Projects are distributed by the Medical Education Committee Secretary, so Susan Russell McGrath, and you can contact her at fmcommittees@dal.ca if you feel you can't mark the project you've been assigned. Reviewers from one site will not review the projects from their site for a possible conflict of interest. In some cases, some projects may have more specific content. So for example, family medicine, emergency medicine longitudinal program projects sometimes have a bit more emergency medicine content. And we do have the option of having some of those projects marked by emergency medicine reviewers through the Dalhousie Department of EM Research Council. So if there's a project that you feel you can't mark, please send it back as soon as possible to Susan Russell McGrath at the email listed. Deadlines. So resident completed final project is due to the Education Committee Secretary by the second Monday in February of their PGY2 year. After that date, projects are then distributed to faculty for marking and evaluation. And it's really important to note that faculty have just 4 weeks to mark the project. So please, please don't be late. There are sometimes projects that could be up for awards that may not get awards if the resident doesn't get the project in on time, or if the faculty reviewer does not get the paper marked in time. So if there's extenuating circumstances where you can't get it marked in time, please send it back as soon as possible. It's very important to abide by this 4-week rule. And please note that the 4 weeks does include if there's any revisions that need to be reviewed. Oral presentations for the projects are usually in May, and each site has a project presentation day. So we'll look at marking domains and how each project is marked. They are marked based on domains such as defining the question, the relevance to family medicine, and this does include the domain-specific competencies required for awarding the certificates of added competence, so that being palliative care, emergency medicine, etc. Researching or information gathering, results, discussion, methodology, organization, quality of the language, proper citation, and quality of references. So project types have slightly different domains, and project types that have similar domains may actually be weighted differently. We do have marking rubrics that are part of the resident project guide, and resident and project supervisors should be aware of how they're being marked. So overall, as a reviewer, you will provide a final grade for the paper you are marking. So an outstanding would be anywhere between 90 and 100, highly acceptable 75 to 89, acceptable is 60 to 74, and requiring revisions is less than 59. A project must be sent back to the resident through the Medical Education Committee Secretary with comments pertaining to any revisions that you see necessary. Residents will have to resubmit the project with revisions once they're complete for you to mark. So if you're marking a project that does require revisions, do not assign any marks to the domains on your marking rubric. Instead, just circle or indicate the domain that requires revision and provide some constructive comments. There are 3 questions on the marking rubrics that are required to be a yes. So if you're marking no for these 3 questions, it has to be sent back. So stop marking and send the project back. So the 3 questions are relevance to family medicine, quality of the language, and proper citation. So again, only provide a final grade for those in the outstanding, highly acceptable, or acceptable range. And I'll take some time to go through the rubrics shortly. So previous years, we did use just one rubric for marking all types of projects. And we heard feedback from faculty that it was not specific enough for all project types and that it was difficult to use and hard to generalize. So we now have made 3 marking rubrics that we feel are more tailored and detailed to help reviewers. So there's one rubric for research projects, practice quality improvements, or audits. There's a rubric for an educational tool, and there's one for literature review and position paper. The Resident Project Committee removed the option of Mythbuster in 2008, so it will be no longer an option for the 2020 resident graduating class and beyond. So first, let's go have a look at the rubric for research projects or practice quality improvements or audits. So you can see on the rubric there's a spot for the resident's name on the top and your name as the assessor and the date. You can check off if it's a research project or a practice quality improvement or audit project. So on the left, you'll see every row has a specific domain. So defining the research question, you will pick a mark between 0 and 10, because as you can see at the other side, the right-hand column of this rubric, it's marked out of 10. So we have included comments for an outstanding project, highly acceptable project, acceptable or requiring revisions for reviewers to have a look at. But overall, you're just marking that domain out of 10. So then the next item is relevance to family medicine. So this is a yes or no. So it must be a yes to be a project that's going to pass. We do have some explanations of how you may choose your yes or no through the descriptions of outstanding, highly acceptable, or acceptable. Those would all be a yes. But if it looks like it's requiring revisions as part of the description of relevance to family medicine, then that would be a no and you should send it back. Background literature review is marked out of 15. Appropriateness of study design is marked out of 15. Appropriateness of data analysis, 15. And we'll have a look at page 2 here. So results, we mark that out of 15. Discussion and conclusions marked out of 20. Quality of the language, again, is a yes. So again, there's descriptors on outstanding, highly acceptable, and acceptable language, and that would be a yes. But if you feel that the quality of the language is better described in the requiring revision section, then it's a no. Organization of the paper is marked out of 10, and again, proper citation and quality of references must be a yes. So you can see there's a total mark out of 100, and the project should have 3 yeses to be a pass. There is a spot at the bottom for feedback, and I think residents do like and appreciate if there's comments or specific feedback you'd like to mention. So we'll look just briefly at the educational tool rubric as well. Looks very similar. So again, resident's name at the top, your name as the assessor, and the date. And it's an educational tool as a type of project. So for these projects, to identify the need for the tool, we mark them out of 20. Again, there's relevance to family medicine, must be a yes. Information gathering, so literature review on the identified problem, is marked out of 15. Researching the existing tools is marked out of 15. Methodology is marked out of 20. Results and discussion, so the actual completed tool, is marked out of 20. Quality of the language must be a yes. Organization is marked out of 10. And proper citation and quality of references, again, is a yes. So again, there's room for feedback, and a full mark out of 100 with 3 yeses is required. And the third rubric is a literature review or position paper. And again, it looks similar, so you would just pick either literature review or position paper with the name of the project, the resident, and the date. So very similar. Defining the question is 20. Relevance to family medicine is a yes. Must be a yes. Research and information gathering is out of 20. Presenting and evaluating sources and others' perspectives is out of 25. Applying sources, reaching conclusions, proving thesis out of 25. Organization of the project is out of 10. Quality of the language, again, is a yes. And proper citation and quality of references, again, must be a yes. So tips. Overall, you can always refer back to the resident project guide as needed, or you're welcome to reach out to myself as the resident project subcommittee chair or to local project coordinators at your site. The guide does have specific tips and tricks when applying to a research ethics board, so if you have any questions on how that was done, you could read about how that may be done in the resident project guide. We often hear from faculty that they'd like a bit of help marking papers with regards to statistics. So if you're struggling, you can always ask for help. So this hyperlink will take you to the next page. It's the Research Methods Unit through NSHA, and that can be a useful resource. As well as you can look at the Resident Project Guide, as there's a tips and tricks when doing statistics. So it's meant for residents performing the statistics, but it's also a nice review for a reviewer who would be looking at how they did their statistics. You also can reach out to project coordinators, and we can point you in the right direction if more help is needed. So tips on appraising references. We also hear that it's difficult sometimes to appraise the reference list. So it's important to look at how many references are there. Is there too many? Is there too little? Are they referenced correctly? So one suggestion would be the APA style. So I'll take you there. And we're all pretty familiar with that. But if they don't choose APA style, just pick a style and format and stick with it. So it should be consistent. It's important to look at how recent are the papers. Some older references may actually be appropriate if they're key papers. Important also to consider the caliber of the journal. So ensure it's a peer-reviewed source. And importantly, for literature appraisal projects, they must be primary research. So they can't use textbook summaries, reviews. It has to be primary research. Some people would recommend doing a quick PubMed Medline search, and that's interesting to just ensure key references are included and that nothing was obviously missed. And it is important to note that residents should be doing literature review on their own. They may ask for help from a university or hospital librarian, but they aren't able to sort of outsource and hire someone to do the literature review for them. So that's an overview of evaluating resident projects. Please reach out to myself, Laura Sadler, or Emily Marshall and Jock Murray as the Halifax site project coordinators if there's any further questions.